Hello, I'm Sheryl McCarthy of the City University of New York. Welcome to One to One. This is an exciting time for our nation and our city. From now until November 4th, we'll be addressing the concerns that New Yorkers and other Americans have going into the election and how the nominees for president and vice president are addressing them. We'll try to assess this extraordinary period with news and government observers and the newsmakers themselves. One of the most highly debated concerns for Americans is health care, its cost, its availability, and its quality. Dr. Karen Davis, president of the Commonwealth Fund, can walk us through the forest of information. The fund tries to promote a high-performing healthcare system, especially for the most vulnerable. We'll discuss how it hopes to achieve that goal and which candidates seem to offer the best solutions. Welcome.
Good to be here.
Before you joined the fund in 1992, you taught economics and chaired the Department of Healthcare Policy and Management at the Johns Hopkins Bloomberg School of Public Health. Long title. 16 years ago, was the conversation and the debate over health coverage as heated as it is now?
Absolutely. In 1992, President Clinton was elected in part because of people's concerns about the economy and about their jobs, and with that, the potential of losing their health insurance. I think what's different is, first of all, the problem has gotten a lot worse since 1992. We've had a major increase in the numbers of people without any health insurance, but we've also had a major increase in the cost of health care, and with that, an erosion of the adequacy of health insurance coverage. So now the issue is not just the uninsured, but those who are underinsured, and even though they have insurance, they can't get the care they need or pay their bills.
Now, I know that the fund just this week released an analysis of the two different, McCain's and Barack Obama's proposals on health care coverage. Has either of the candidates, could you sort of summarize the differences, and has either of the candidates laid out a program that resonates with you?
Well, the good news is that both candidates have laid out health reform proposals, and both want to do something, both about the problem of the uninsured and something about the problem of healthcare costs. But they have very different philosophies that underlie their plans. Senator McCain would give people a tax credit to buy health insurance on their own through the individual market. He says if people are spending their own money, they'll be more cost conscious, they'll get leaner health benefits, they'll pay more of their medical expenses out of pocket, and that'll make them shop for the best doctor at the lowest cost.
But he would also tax them on employer-provided health benefits, correct?
Absolutely. At the same time that he would encourage people to buy insurance on their own, he would kind of discourage employers from providing health insurance, because whatever the employer spends on the premium would count as income to the employee, and they would have to pay income taxes on that. As a result, the Tax Policy Center, which is supported by the Urban Institute and the Brookings Institution, estimate that 20 million people would lose employer coverage, 21 million people would buy individual coverage, and the net effect would be about a 1 million reduction in the numbers of uninsured.
Mm-hmm. Meanwhile, Barack Obama's plan relies more heavily on employer coverage and some add-ons, correct?
Absolutely. He would keep our mixed private-public system of health insurance, and rather than encouraging people to drop employer coverage, he would actually strengthen it. He would require all employers to either provide health insurance for their employees, or they'd have to contribute to a fund to finance coverage for employees buying coverage through something called a national health insurance exchange. So he would keep coverage in force that now exists for 160 million Americans that have employer coverage, and expand it. He would pick up half the premium for very small businesses. He would cover the catastrophic expenses out of public funds. So it would make it more affordable for employers and more affordable for workers, because he would provide a sliding scale premium assistance so that those low-wage workers could afford their share of the premium. In addition, as you suggest, he would expand some public programs. He would expand the Medicaid and state children's health insurance program for low-income adults and children. And he would most importantly set rules, consumer protections, rules on the private insurance industry so that they would have to cover sick people as well as healthy people. They'd have to charge them the same premium. So he would make insurance more affordable. And those rules would apply to insurance plans made available through this new National Health Insurance Exchange. It would apply to insurance markets throughout the U.S.
Is one of the plans resonate more with the Commonwealth Fund than the other?
We have a commission on a high-performance health system, and they have a set of criteria for evaluating health proposals. One of those is universal coverage. Does it cover everyone? As I mentioned, Senator McCain's proposal would cover 1 million out of the 46 million uninsured, so it doesn't really solve the uninsured problem. Senator Obama would require all parents to have health insurance for their children. He doesn't go as far as requiring all adults to buy coverage, which has been done, and successfully, I would say, in Massachusetts. But nonetheless, he would cut the numbers of uninsured by about half. So in 10 years, instead of having 67 million uninsured, we'd only have about 33 million
So
uninsured.
each one would reduce the gap somewhat, but not quite get there. And they both seem so patched together. And my question is, I mean, with just about everybody seeming to agree that we need universal health coverage, why is it so hard to get there?
Well, I think it's hard because it does take some money. And one of the questions raised about both of these proposals is what will it cost the federal budget? Again, the Tax Policy Center estimates that Senator McCain's plan would cost about $1.3 trillion to the federal budget over 10 years. Senator Obama's plan about $1.6 trillion. So both are expensive proposals. And the real question is, where do we get the money? Senator Obama has said he would let tax breaks for people with incomes above $250,000 expire and use those revenues to help finance his health plan. Senator McCain hasn't said how he would finance his. But even at that, it's going to take a more strenuous approach to making our healthcare system more efficient. And both candidates have talked about what they would do in that regard, although in very general terms. They both would expand modern health information technology. Senator Obama would put $10 billion a year into 5 years to getting us to an electronic health information system. They both believe in more research on what works. Which drug is better? Is that new drug really better than the old drug? Why are we paying more for the new drug if it's no better than the old drug? So something called comparative effectiveness research. And both have talked about changing the way they pay doctors and hospitals to reward those doctors and hospitals that get the best results and use resources most efficiently. So not having duplicated tests or wasteful, unnecessary care.
Now, I am assuming that the United States is still the wealthiest country in the world. I mean, we may have slipped a little recently, but I'm assuming that's still the case. And yet you have countries like Canada, England, and a number of other European countries that have universal healthcare systems, and they pay for them somehow. What's the hang-up? I mean, you suggested that it was money. Is there something about the way healthcare is structured in this country that makes it more expensive here than in those countries, or is something else going on?
Well, absolutely. You're right that the U.S. is the only country that among the major industrialized countries that fails to provide coverage for everyone. And yet we spend more than other countries. We spend twice per capita, $7,000, more than twice per capita of most of these other countries. Canada, Germany might be spending $3,000, $3,500, but far less than we're spending. So why is that different? First of all, other countries have a single system. They don't have a fragmented system with lots of different insurance companies with lots of different rules. But they also think government should be getting value for what it's spending. So they negotiate fees with doctors. They negotiate hospital budgets with hospitals. And they invest in the things that have high payoff, namely primary care, and making sure that everybody has a regular doctor that's accessible to them, that knows them well, where they can get conditions detected at an early stage and dealt with, rather than having conditions deteriorate. That happens all too often in the U.S.
It seems to me that in the United States, we have made a decision that doctors ought to be able to earn a lot of money. And that's, that's the incentive for providing good health. That doctors get a lot of money. That the pharmaceutical companies ought to be able to make big profits. Is that part of why it's so expensive?
That's absolutely an important part of it. Other countries negotiate pharmaceutical prices. They have these institutes that are set up to rule on whether a new drug really is beneficial, whether it's really worth the price, or to negotiate a good price with a pharmaceutical company, or it's not covered. So that's a lot of clout when you say you can't sell that product in this country. So yes, that studies show that the U.S. spends about more than twice what other countries spend for the same drug that's being sold here in the U.S., and that's one piece of it. But you're right that it pervades the whole healthcare system.
That we've had allowed it to be more market-driven than some other countries?
Right. The U.S. has had this philosophy, particularly in the last 10 years, that the private market will solve all of our problems. And that's why we've been shifting more financial risk to beneficiaries, having them pay higher and higher deductibles or more expenses out of pocket, buying their own health insurance on the individual market. But that hasn't been coupled with consumer protections. It hasn't been coupled with effective oversight of the insurance industry. So what we've seen is that premiums have gone up really rapidly, even faster than what insurance companies are spending on medical care. But that difference is going for administrative overhead and profits. If the U.S. had the same administrative expenses as the best country, we would save $100 billion a year. So that's a lot of money. Wow. That would finance a lot of care. So that's part of it, is that we really haven't looked at our system, our market system, and say, what can it do well? Where does it need some oversight, some rules that really govern the operation of the market? The major failing, particularly in the individual insurance market, is that they make money by taking healthy people. Right. If you charge a premium and people don't have any medical expenses, you can make money
a lot of money.
And a few states, like New York, have required them to take both sick and healthy people.
We're going to take a short break, and we'll be back after this message.
Real men know that getting tested is the way to take care of their families. That's why real men wear gowns. For a list of the tests you need, go to ahrq.gov.
Welcome back to One to One. I'm Sheryl McCarthy of the City University of New York, and I'm talking with Dr. Karen Davis, president of the Commonwealth Fund. I have heard that the only people who seem to have truly comprehensive medical coverage are federal officials. Could you describe what kind of health insurance they have, and why do you think so few legislators are unwilling to give the same kind of coverage to their constituents?
Well, I think it's a very good idea to open up the federal employees health benefits program to Americans who can't get health insurance now, who can't get it in the individual market, can't get it from their employers. So certainly making it available through some type of what's called a national health insurance exchange or connector makes a lot of sense. The way it works now, the federal government covers 4 million workers or retirees and their family members, so it's about 8 million people altogether, through a variety of health plans. There is a standard benefit plan that's available through a private carrier. That's sets a standard for what kinds of services should be covered to members of Congress and to all federal employees. It has reasonable limits on what people pay. You might pay a $300 a person deductible, but it covers hospital services, physician services, prescription drugs. And if you want to pick a care system, that's available too. So it's not just one choice. There are multiple choices, at least a dozen available everywhere, and more in some geographic areas. Senator Obama has proposed something along this line, making a plan available to people who can't get coverage any other way that would be at least as good as members of Congress. He said he would offer private plans, but he would also offer a public plan. And that's very significant. It really forces private insurance to compete with a public program like Medicare. Medicare has 2% administrative costs. The standard plan available to members of Congress has about a 6 or 7% administrative cost. Employers pay 10, 15%. Those in the individual market pay overhead of 20, 40%. Small businesses pay overhead of 40%. So you're talking about 40% of the premiums not going for medical care. But by making a public plan like Medicare available to the uninsured, it's saying to private insurance companies, you've got to compete on value and efficiency. You can't compete on just enrolling healthy people and avoiding the sick. You have to do something to get healthcare costs down, because the federal government can provide this coverage. It's large enough to go at risk. It can do that for only a 2% add-on in the Medicare program. We want you to do the same and bring those high administrative costs down. So that's the beauty of building on a system that now exists. There are other systems to build on. We have the Medicare program. Currently, you have to wait 2 years if you're disabled to get covered. That could be eliminated. It could be opened up to older adults, retirees who really have a very hard time finding affordable insurance coverage on their own.
I know that the fund has, that you're very high on Medicare, and you've encouraged using it to expand health care to the uninsured by using an insurance connector. How would that work?
Well, we've had an example of that in Massachusetts. In 2006, the Commonwealth of Massachusetts enacted a universal health insurance bill, and it set up a public agency, state agency, called the Commonwealth Connector, and insurance plans apply to offer coverage through that. And the connector can say, well, the premium you're charging for that is really not reasonable. You go back and rework that and come back. So it reviews premiums for their reasonableness. And they set standard benefits. You can have a gold level benefit or a silver or a bronze. So you can buy more generous coverage or less generous. But most importantly, you can compare the plans, the gold plans, against each other, look at their premiums, know they're roughly equivalent, and you can decide which one you want. You can enroll over the internet. You can look up the information on the plans that are available and pick one that works for you and know what the premium would be. So they've markedly reduced administrative overhead. They've reduced premiums for different age groups, and they've improved coverage. They've cut the uninsured rate in half, and now Massachusetts has the lowest rate of uninsured of any state in the nation. So it's not a theoretical, how would we make this work? It's a matter of having a state agency charged with setting rules on what are reasonable premiums, what are reasonable benefits, making information available to the public about what the premiums are, what the benefits are, and making good choices available to people. The other thing that Massachusetts did that's really key, and again, this is part of Senator Obama's plan, is depending on what your income is, you get help paying that premium. If your income in Massachusetts for a family of four is below about $60,000, part of that premium is paid by the state. If it's under $20,000, it's all paid, and then sliding scale up to about $60,000 for a family.
So we happen to be in the midst of this economic downturn, to put it mildly. What impact do you think that, as well as the impact of any potential bailout, federal bailout, is going to have on our getting to universal health insurance?
Well, I think our financial crisis is going to make our health crisis worse. What we know, anytime you have an economic downturn, you have higher unemployment. More people are without health insurance. Fewer employers are able to afford to keep benefits in force and either drop it or cut back on benefits. So we've got a health crisis in this country. We've had a 20% jump in the numbers of uninsured. We've had a 60% jump in the numbers of underinsured. We've had a doubling of premiums in the last decade. It's going to make it worse, but it's going to mean that we're going to have to act. And I think we're going to have to realize that the course we've been on, simply leaving this to the private market, is not working for American families. Studies at the Commonwealth Fund find that 79 million Americans have problems paying their medical bills, have accumulated medical debt. They've added to their credit cards to pay their prescription drugs at the pharmacy. All of this is going to add to our credit crisis, our debt crisis in this country. So we can't afford to say, oh, well, we can't deal with that problem. We got this other problem. They are part and parcel the same problem. Mm-hmm. American families not being able to make ends meet, not being able to pay their medical bills, not being able to pay their mortgages, not being able to pay their credit cards. So it means we're going to have to act. The question is how we'll go about it. It may mean that we need a plan and some steps, 1, 2, 3, of how we get there, not doing everything all at once, but investing in children first by covering low-income children, by opening up, for example, Medicare to older adults who can't get coverage that's affordable through the private market. But it also means getting serious about those kinds of steps that other countries are using to control healthcare costs. It does mean the government's going to have to start negotiating pharmaceutical prices. It does mean the government's going to have to be more proactive about getting rid of waste in the healthcare system, whether that's administrative costs or it's duplication of tests. Just recently, the Medicare program said it wouldn't pay for medical mistakes, mm-hmm. that there are certain never events that never should happen that the government's not going to pay for. So if you leave something in the patient after surgery and you have to go back and take it out, we're not going to pay for that second surgery. And I'm sure if Medicare does that, a number of private insurers are going to follow that lead. But we need to go.
Who would have to pay for it? Who would?
Well, the hospital's going to have to get serious about changing their procedures so those things don't happen.
Yeah.
And I think, once the incentive is there, right now they make money by making mistakes. And once they know they're not going to get paid, they're going to have checklists, that keep track.
Who are the biggest opponents of universal health care? Is it the AMA? Is it the insurance companies? Is it the pharmaceutical companies? Or all of the above?
Well, I think at this stage, nearly everyone's recognizing we're going to have to do this, that we just can't keep going the way we're going. And so most of the organizations have their own proposals. Now, some of the groups would prefer a minimal role for government. So as we saw with the Medicare drug benefit, we wound up doing that as a totally private benefit. You don't get it directly from Medicare. You have to buy a private drug plan because the pharmaceutical industry preferred that the government not negotiate prices, not be offering its own coverage. So I think we're going to have to cover people, but we're going to have a public alternative. If the private sector can do a good job, fine. If not, then we need to put a public option in front of people that has more affordable coverage, because it doesn't spend so much money on either high overhead or high prices.
How is, we know about the dire problem with uninsured people. How is the United States doing in terms of the health of its citizens compared with other countries? Because I hear that we've been slipping behind in a number of key respects.
Well, that's a very good question, and I think that's why we're raising a lot of questions. Not only do we spend twice what other countries spend, but we don't fare well on the health of our people. There's a measure of health outcomes called mortality amenable to medical care. There's certain things like homicide that don't aren't caused by the healthcare system. But when you look at the things where medical care could make a difference, diabetes, heart disease, asthma, and look at the U.S. mortality rate compared to other countries, we're now 19th out of 19 countries on mortality amenable to medical care. So more people are dying in the U.S. from things that could be prevented than are dying in other countries. When we look at other measures like infant mortality, again, we're way behind where other countries are. So we're not getting the value for what we're spending that other countries are getting.
What has pleased you most about this campaign?
Well, I think it's terrific that we're getting serious about the real problems in America, the problems with our healthcare system, the problems with our economy. And I think we're having to get realistic about what does work. And I think we're having to get realistic about what works in the U.S. and what can we learn from other countries. You know, for a long time, the U.S. hasn't thought it has anything to learn from any other country. And yet, other countries are ahead of us in adoption of information technology. Here, only a fourth of doctors have computer systems that handle medical records. In other countries, it's almost 100%. What are they doing that we could be doing? And so I think we're looking at the numbers, we're looking at the data, seeing where we do well and where we don't do well, and trying to learn from that.
It's such a serious problem. I hope that we are, in fact, starting to move more in the right direction. And I want to thank Dr. Karen Davis, President of the Commonwealth Fund, for joining us today. For the City University of New York and 1 to 1, I'm Sheryl McCarthy.